Good afternoon, everyone. It's just after 2 o'clock, time to get started on today's briefing. Joining us today, we have Milwaukee Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, Marlena Jackson, Interim Commissioner of the Milwaukee Health Department, and Beth Ridley, founder and CEO of the Brimful Life, will be joining us to share her story of recovering from COVID-19. Please note, Mayor Barrett will be departing after his statements this afternoon due to a prior commitment. Mayor Barrett, you're starting us off today.
Thank you very much, Sydney. And the prior commitment, just so you know, is a call with the incoming intergovernmental relations team from President-elect Biden's office. They're reaching out to a number of mayors throughout the country. And I'm sure the county executive will be getting a call when they do the county executives. So they're starting the outreach, and I like it. And David's smiling too, so I'm sure he's going to like it just as much. But good afternoon. And I think it's really important today to mark a special day. Public Health Workers Day was yesterday. And I think there is no year more important for us to thank our public health workers than 2020. And the fact that yesterday marked Public Health Thank You leads me to take a moment to recognize all of the dedicated individuals who work every day to protect our health and safety, especially as we fight COVID-19. Your efforts save lives. We are so grateful for the tireless work of every single doctor, nurse, public health leader, public health worker, and healthcare provider. The people in the trenches, the people who work as orderlies, the people who clean the rooms in the hospitals and the nursing homes, the people who go out and make the house calls for us. They have been working nonstop to care for our community despite extraordinary challenges. And we can see this around the nation right now with the shortages in healthcare facilities, with the shortages in nursing homes, with the pressure that's being placed on our public health workers. And we've seen it. We've seen it firsthand with our public health workers who are out there working to basically enforce our public health orders and some of the treatment that they have received. This is a time to thank these public health workers, not to castigate them, not to give them a hard time, but to work with them. So I especially want to shout out all of our Milwaukee department workers by recognizing their extraordinary research to public health threats and emergencies. They have done an outstanding job of working with community organizations, healthcare providers, and businesses, and most importantly, on dealing with issues like COVID-19, COVID-19 testing, care, and best practice. Anybody cares? Back, not a real pat on the back right now, a virtual pat on the back. So I want to now segue to Thanksgiving. You have heard us talk about Thanksgiving and the importance of staying home and avoiding gatherings. You may be thinking to yourself that joining extended family for a Thanksgiving meal cannot be that dangerous. I know that's what I think. I know that's what my wife thinks, but we also have just taken the time to make the decisions. But let me lay out a hypothetical scenario to help illustrate the importance a little better. Suppose someone was exposed to COVID-19 at work through a friend or someone in the community. A few days later, that person feels perfectly healthy. Just to be safe, they get tested for COVID. The test comes back negative and everyone has peace of mind. A few days after that, they enjoy a Thanksgiving meal with 20 family members. A few more days pass and that person starts feeling ill. They get tested for COVID-19 and now they find out that they are positive and that they were contagious while they were around their family members, many of whom are high risk. Could this be? Well, remember, it can take up to 14 days after exposure to show symptoms and to test positive. That's where we run into a lot of problems. People test negative and they assume they're out of the woods. That negative test is a snapshot. It's a good snapshot to have, but it's simply a snapshot. So just because you feel well doesn't mean that you're in the clear. COVID-19 is spreading faster around our community and across the nation. This holiday season, it's really better to be safe than sorry. So show your gratitude for family by protecting their health. Opt for a small meal with members of your household and consider a virtual meeting or a phone call with extended family. I know the holidays look different this year, but this won't be forever. Please do your part and help us stop the spread. Now I want to turn to our community testing numbers. Again, a busy week here in Milwaukee on testing. On Monday, we had 2,568 people tested at Miller Park. That's a lot of people going through that parking lot. We also had 634 on the Northwest Health Center. Again, a lot of people. And on the south side, 488. So a total of 3,690 just in one day this holiday week. As a reminder, all 3 community testing sites will be closed in observance of Thanksgiving on Thursday, November 26th. The Miller Park and the Miller Park site only will reopen on Friday, November 27th. But the Northwest and South Side centers will remain closed on that day. Now I want to talk a little bit about 16th Street because they have been such a great partner to us. This morning, I joined Commissioner Jackson to share some great news about our COVID-19 efforts here in the city on the South Side in particular. We were able to allocate grant money supplied by the state of Wisconsin as part of the COVID-19 aid package to our longtime super partner, 16th Street Community Health Centers, for 2 separate structures. One for drive-through COVID-19 testing and another for additional clinic space to expand patient care capacity. 16th Street was chosen because of the volume of testing and patients served. It is very culturally competent to serve the South Side, where we continue to have very many issues with high percentage of people being tested who are positive. Throughout the pandemic, we have seen the crucial role that community organizations play, and 16th Street in particular, and the need for testing and care in the neighborhoods who have suffered the most. What's great about our community organizations is that they help reduce financial, transportation, cultural, and language barriers for individuals seeking testing. And that's because our residents trust these organizations, and they trust that the organizations are looking out for their best interests. And this trust, which is a very important concept, helps combat the misinformation and fear that is out there around testing and care for COVID-19. 16th Street Community Health Centers offers more than just testing. They also provide residents with access to behavioral health, social services, and more. And now that the winter months are getting even closer, it's important that we make sure that the structures that are used are winterized and safe for residents to use. So a lot of information, but a lot's going on right now. And I know the county's doing a lot of work too. So I want to turn it over to County Executive David Crowley. Mr. County Executive.
Thank you, Mayor Barrett. I also want to start off today by wishing everyone a very happy Turkey Day holiday. Thanksgiving is a day focused on reflection and giving gratitude for all that we have. And I had the opportunity today to take part in the Make a Family Smile Turkey giveaway with the We Care crew at the Martin Luther King Community Center today. And everyone was masked up for the drive-through event. But even through the mask, you can tell that there were a lot of people who were smiling. This year has thrown us more than a few curveballs, but it's also stripped down all of the extras, allowing us to focus on the people and the things that make life meaningful. And when I think about the people I'm most grateful for this year, it's definitely my family. But the Milwaukee County public health professionals rise to the top of that list. Yesterday was Public Health Thank You Day, a day to officially recognize the public health professionals who work tirelessly to protect the health of all the people throughout this whole community. And it's a tall task right now. In addition to the life-saving work that these folks are doing with COVID-19, they're also dedicated to other important work, like reducing infant mortality, developing and distributing vaccines, preparing us for natural disasters, and so much more. And while Milwaukee County doesn't have its own health department, we're lucky to have amazing public health professionals throughout the county who are day in and day out to keep this community healthy and safe. And they deserve our support and respect, especially this year. So again, thank you for all that you do. But more than just words, let's use our actions to show our deep appreciation for those on the front lines of the COVID-19 crisis. This week, we can share our gratitude by celebrating the holiday only with those who live in our household. And as always, washing our hands, wearing a mask, and watching our distance when we're in public. Dr. Weston and Commissioner Jackson will talk more about why these behaviors are so important and really the best way to show gratitude, not just those who work in healthcare, but also those who for your own families and our friends and our community. And so we just need to make sure that we are abiding by all the guidelines that have been set place and put forth by the CDC and our public health officials locally to make sure that we're doing our due diligence to stay safe of this holiday season. And with that, I'd like to turn it over to Dr. Weston.
Thank you, Mr. County Executive. Good afternoon. First, to our numbers, we have had 63,268 confirmed cases of COVID-19 in our community and 635 individuals who have died. At the state and the local level, there are some signs of a pause in the constant upward trajectory that we've been seeing, at least in cases and hospitalizations. We can hope with great caution that the messaging and resource allocation and the work of our public health professionals may be making a dent in our disease burden. However, we enter Thanksgiving very aware of the catastrophic effects that gatherings could have through increased transmission of disease. We've not yet experienced in this pandemic a holiday like Thanksgiving with indoor gatherings. And managed incorrectly, it could easily lead to a spike in hospitalizations that would overwhelm any health system. And that leads me to the topic I want to talk about today. There are three words that have, to a large extent, led to the incredibly high levels of disease that we see today. Three words that can be so dangerous during the times in which we're all now finding ourselves. And those three words are, I feel fine. I've heard these three words so many times over the last few months, but especially over the last week. I was exposed to COVID, to someone with COVID, but I'm heading to the grocery store because I feel fine. The test came back positive, but I'm going to work because I feel fine. And I'm going to Thanksgiving dinner because I feel fine. A recent report out of the CDC stated that over half of the spread of COVID-19 was from those without symptoms. This may lead to the question of who does not have symptoms but can still spread COVID-19. And the answer is every single person with the virus. That is how COVID-19 works. So here's a very typical timeline for COVID, similar to what the mayor outlined, but certainly worthy of reemphasis. On day one, you're exposed to COVID-19. Could be at the grocery store, at work, at a friend's house. The virus enters your body on day one. On day 5, you feel fine, but you're worried, so you get tested and it's negative. There's not yet enough virus in your body to be detected. On day 8, you say, I have a negative test and I feel fine. And you head over to Thanksgiving. You're very contagious and COVID is so easily spread that it's very likely you infect everyone at that gathering. 2 days later, day 10, your symptoms start to show up. You test positive. And you no longer feel fine. I feel fine means very little with regard to COVID infection. Everyone feels fine before they don't. And everyone feels fine when they're the very most contagious. And that's a huge part of the reason why COVID is so dangerous, why the disease has been so hard to control. So in 2 days, when you think of gathering with family, remember that I feel fine means nothing. A negative test means very little. The only way to be safe is to only gather with those in your household. Please do not put any credit or any trust in the statement, I feel fine. Thank you. I hope that you find a way to have a happy Thanksgiving and stay safe. And I will hand it off to Commissioner Jackson.
Thank you, Dr. Weston. So on today, I first want to also acknowledge that yesterday was Public Health Thank You Day. I have had the privilege of working in this interim role for, I think, going on 7 weeks now, maybe 8. And I have never been more impressed and more in awe with the dedication and the time that I have seen committed and dedicated to fighting COVID-19. I want to take this moment to acknowledge every single branch and division within the Milwaukee Health Department, which includes our Consumer Environmental Health Division, our Maternal Child Health Division, our Office of Violence Prevention, all of our medical services team, as well as our policy, innovation, and engagement branches. Each of those individual divisions and branches have worked specifically on COVID work over the last 8 months, but over time have also made such an impact when it comes to how we deal with violence, how we deal with maternal and child health, how we make sure that our restaurants and bars are safe for all of the public. And I am just eternally grateful and privileged to serve in this role and privileged to work with the team that I get to work with every day. At the end of this pandemic, when we all get to sit back and think about what stories we will tell, we will have many good stories. We will have stories of dedication and true heroes and the heroic work that has been done within the Milwaukee Health Department. So again, I thank you for that work. Now I'm going to take a moment to just walk through some Thanksgiving guidance. As we are 2 days away, I also want to take an opportunity, as I believe the county executive said, around thanking not only our public health workers, but thanking every individual who throughout this pandemic has made it their personal responsibility and their personal goal to listen to the experts when we give advice and to take that advice seriously. I am thankful to individuals who have worn masks. I am thankful to individuals who have made a conscious decision to stay away or stay home, whether they are sick or they feel unwell, or whether they understand the risk of going into risky situations. I am thankful for individuals who are watching their distance. I am thankful for individual establishment owners that have made their work, have made their particular establishments safe for the individuals and the patrons that they serve. It all adds up to meaning that we are fighting this disease together and that we are working to create a quicker get back to normal. So with that, I'm going to ask Sydney if she can bring up the Thanksgiving guidance as we prepare for 2 days to give thanks as a nation. So first of all, we are, you've heard it many times before, the safest thing to do in the next 2 days is to celebrate at home. Please feel free to figure out what that means for you as you celebrate Thanksgiving at home. Prepare those traditional dishes that your households eat, whether it's the good macaroni and cheese, it's the turkey. And we'd also say eat as much as you want this year. You have a reason to just go ahead and dig in. Additionally, if you can host a virtual dinner, it is a much safer environment to do. Share recipes with family and friends, share those stories that we all know we would normally talk about around the Thanksgiving table. We want you to share those virtually. Also, make sure that you're putting up decorations. Make the time as festive as possible. We know that it, again, can be a time where, especially in the pandemic and there's COVID fatigue, that there is lots of mental health concerns that people have. So take those small opportunities to put the turkey on the table or put the festive wreath on the door. Those little things make a difference. Also, we know that there are particular traditions around sports and around parades and movies at home. Please take advantage of all of those things. And if you do decide to gather, we want to make sure that you are gathering wisely. Keep it small, keep it local. If you can, stay outside. If you are inside and you can open doors or windows, do that. That ventilation makes a difference. It's another layer of protection. Also, wear your mask when you are indoors. If you are not eating your food, then you should have your mask on, and you should also still social distance. Make sure that you're washing your hands frequently, and especially before eating. And then also avoid contact with non-attendees for 14 days before and after your gatherings. And lastly, for Thanksgiving, what we would really like for you to avoid is large gatherings, especially indoors. Potlucks and buffets where there are multiple hands touching multiple spoons or multiple dishes is something that you should avoid, meaning that you should use disposable plateware or disposable dishware if possible, if you're with a larger crowd. Also, please look at avoiding crowds such as stores, parades, or any kind of events or sporting events, particularly as we think about our traditional Black Friday, the day after Thanksgiving. Being in crowded stores and crowded lines is not recommended. There are lots of online opportunities to do Black Friday. I'm guilty of that myself. So please make sure that you take those opportunities online if you can, instead of putting yourself and others at risk by going to Black Friday lines and those kind of things. And then lastly, avoid anyone who has had any contact or who has been sick with COVID-19 recently. And so with that information, I want to again thank you all, wish you a happy Thanksgiving, and I will turn it over to Beth.
Thank you very much. And I appreciate the opportunity to be invited to talk about my experience with COVID. I think it's important to hear different stories because the symptoms and the experiences are so incredibly different. I think that's why this disease is so hard to get our hands around and understand, because it seems like it impacts each individual very differently. In the case of my husband and I, we're a little bit of trendsetters, I guess, not in a good way, because we both came down with COVID at the exact same time in early March. This was before masks were a thing, stay at home was a thing. I think we were hearing about coronavirus, but not quite sure, if we should take it seriously or what to do. So we continue to go about our regular business. And I think the symptoms that we started to experience were really just sort of like a scratchy throat and kind of feeling like we were coming down with a cold. That in itself was highly unusual for us. We are both extremely healthy. I have never missed a day of work, neither has my husband, due to illness. So we were even questioning like, oh, this is weird that we're coming down with a cold. The symptoms quickly escalated to, chills and fever, but we were having a hard time piecing it together and really understanding what this was, because at that time, the only symptoms that they were communicating around COVID-19 was a very high temperature and loss of, difficulty breathing. So our temperatures hovered at about 100 and they didn't go above that. So I didn't really feel that fell in that category of a really high temperature. And neither one of us had a difficulty breathing. From there, my symptoms kind of took another turn, and I had horrible headaches consistently, felt nauseous consistently, and ended up losing 14 pounds in 9 days. My husband ended up losing about the same amount of weight in the same period of time. He had the same symptoms, but he did end up having difficulty breathing. And this is someone who is an ultra marathon athlete, and he would walk up a flight of stairs and have to literally sit down, or he would be in the middle of brushing his teeth and he'd have to pause and take a rest to catch his breath. Still at this time, we thought probably this could be COVID-19, but there was no testing available. So we weren't even sure what to do. And then sort of the seriousness of maybe what was going on started to settle in. We have 3 kids. And so the concern that if we are both sick and if we both have to be hospitalized, what would happen to our kids? So all these things were going through our mind. Eventually we did start to feel better, but it took a good 3 or 4 weeks. I think the biggest struggle that we had was just complete loss of energy. It was hard to do anything. And I'm a solopreneur, an entrepreneur. So to be sort of set back from my work for that long, it had a significant impact on my business. Even once our primary symptoms went away, it probably took another 3 weeks to feel like we were fully back again. Some of the things like the headache started to linger, the nausea, but eventually, I would say after a full 6 weeks, we felt back to normal again. But if you've ever been sick, even for a couple of days, 6 weeks not feeling well, you start to really appreciate how health is wealth. And again, with a job, with kids, that's a long time to not really be feeling well. So that's our journey. I did end up getting an antibody test just because I was curious. I never did get tested for COVID because it wasn't available at the time. And I did show that I had the antibodies. So now we know that the symptoms that we were experiencing, even though they weren't very, communicated at that time are very, very, very common symptoms. I think for us, the nail in the coffin that sealed it for us that we had it was when we lost our sense of taste and smell, because that's highly unusual. And at that time they were reporting that that's one of the symptoms as well. And I think for me, the main takeaway from all of this is that, protect yourself and those around you, because to me, COVID-19 is almost like Russian roulette. You don't know what version you're going to get or how it's going to impact you. My husband and I are extremely, incredibly healthy people. Like I said, it's been years since I had a cold, and I only had the flu once in my entire life in high school. So I was shocked to what extent that it had, impacted me and my husband. And then sometimes you hear old people with a lot of underlying conditions who get it and survive. I don't want to find out which version, someone I love or someone in my family or a friend or a coworker would get. I just feel like it's very random and you don't know. And also clearly, I think the virus was among us much longer than any of us ever appreciated. Like I said, we got sick in early March. Clearly, we caught it from someone from somewhere. It's insidious, so I think we just have to be really, really, really mindful and not assume or be cavalier with our actions.
Thank you, Beth, for sharing your story today. We will now open it up to any questions from the media.
Hi, this is Angie with Fox 6 for the health department. Wednesday is typically known, the Wednesday before Thanksgiving is known as a time where people sometimes go to the bars. Is there any concern from the health department on just making sure that people are following social distancing if they do take part in this?
Right. So, as we have shared already, it's not safe to gather anywhere. It's not safe to go to a bar tomorrow. It's not safe to go to a bar today where you're hanging out, drinking without your mask, which is why we have orders in place with the Moving Milwaukee Forward Safely order that puts those mitigation steps in place. But we know that small and large gatherings are not safe at this point due to our positivity rate and disease burden in the city. So we are advising everyone that they should be staying home, like whether that's from the bar or from their friend's house, they should be home.
Our next question comes from Sharon Bajenda at CBS 58. The American Association of Pediatricians says over a span of 2 weeks, there's been a 28% increase in child COVID-19 cases for those ages 17 and under. How does this compare to Milwaukee County's number?
So we have seen a somewhat younger trend in cases, certainly over the last few months. Our highest number of cases are in our 20 to 29-year-old age group, but certainly we're seeing them in the 0 to 9, the 10 to 19 age group as well.
Follow-up question from Sharon Bajenda. According to the State Department of Health Services, the 7-day % positive tests by person reached a high of 36.5% on November 11th and 12th, and it's now the 24th. We've seen a continual downward trend in % positive tests since. Have we reached a peak?
So I'll start on that. I certainly hope so. I hope that the trend continues. I think the risk is that we're going into winter, we're going into Thanksgiving. Hopefully behaviors have changed. People are distancing more. There's less gatherings, whether they're large or small gatherings, that those aren't happening. I mean, that's what's going to drive down our numbers. It is a percentage, it can't rise forever, but the fact that it appears to be going downward a bit is promising. I think more concerning, obviously, is, today the DHS reported for the first time, we've seen over 100 daily deaths in Wisconsin. There's 104 people who died in Wisconsin today from COVID-19. That's 104 people who won't celebrate at the Thanksgiving table next year. So we have to slow down the spread. We have to stop seeing these record-setting deaths in addition to cases and hospitalizations.
And I would just add, while we do see that decrease, I would echo Dr. Weston in that it is hopeful and it would be something to be thankful for this week particularly. But we look at all of our gating criteria when we determine our the battle that we are fighting against COVID-19. And so when we look at all of our gating criteria as a whole, case numbers is only one piece of that. So we also have to look at the hospitalizations. We also have to look at the number of tests that are being done, as well as looking at our PPE and our other gating criteria. So it's one piece of information and one data point that helps us to determine how we're doing overall. So we are absolutely not out of the water, absolutely not able to quite take a breath yet. We're still watching very closely.
Next question, also from Sharon Bajenda. It's expected that more than 47 million people are going to travel by car this Thanksgiving to visit family. For the panel, what is your reaction to the amount of people going to visit family?
Well, I would say it's a little troubling. We know that our local health departments and the CDC has recommended against traveling. I see the 47 million people traveling by car, but I think I just seen a report about 3 million traveling by plane. And so we have to do our due diligence. We cannot let our foot off the gas. We must remain vigilant as it relates to this virus, but we have to protect ourselves. And so do everything that you can to protect yourself, your family, and your household. And that's what we need to be focusing on.
Our next question is from WISN 12 for Dr. Weston and Commissioner Jackson. As we head into Thanksgiving with the potential for gatherings, can you both share what you're preparing for over the next couple of weeks in your respective fields?
So I can start and share that for the health department, specifically, what we have seen throughout this virus and the pandemic is that after every holiday, there is some type of surge. And so what that means for our department particularly is that we're making sure that our case investigators and that our contact tracers are prepared and that we have our numbers where we need to be so that we can make sure we're reaching out to individuals, as well as making sure that our epidemiology team and our data team are prepared to start looking at data and making sure we can identify hotspots, as well as identify where we can message differently in regards to testing moving forward.
Yeah, and I would say on my end, one aspect is the unknown of what Thanksgiving will bring. What those 47 million people traveling in their cars to gatherings will mean for our country, but more specifically for Wisconsin and for Milwaukee County. So certainly we're planning to expand testing even more than it's already been expanded, particularly with a equity lens, a racial equity lens, and thinking about what communities are perhaps not able to seek out testing as easily, what communities are in need of more testing. Health system planning will certainly continue. We're stretched very thin for hospital beds, whether in Milwaukee County and in the rest of the state. And then really just watching the numbers and understanding what Thanksgiving is going to bring. Like I said before, we have not yet in this pandemic experienced a time quite like this, with the cold weather, with the peaks that we're seeing, and with what could potentially be a large gathering event, really leading to a much higher disease burden.
Thank you. Our next question is from Sari Lesk at the Milwaukee Business Journal. The Common Council this morning approved higher penalties for violations of COVID-19 rules. If Mayor Barrett signs it, how will the city determine what fine between $500 and $5,000 to impose per violation? Is the city considering updating its Phase 4.2 order? If so, when and what changes are you making?
So yeah, we are grateful for the Common Council and their support of increasing the fines. We are not yet at a space of being able to share what that update looks like when it comes to actual doing the citations, but we're working every day to make those decisions and to be mindful of the impact of those decisions. So it's not something that we go into lightly. We give it lots of thought. We talk to lots of people and lots of owners of establishments to make sure that we are making decisions that are fairest. And in regards to the order, again, we continue to look at numbers daily, and we will be looking at those moving forward and making sure that we update the order accordingly.
Our next question comes from, it's also, there's a follow-up question from Sari Lesk, excuse me. What did your department see in terms of compliance from business during inspections from this past weekend?
This past weekend, we seen mostly compliance. We also would also share that as a department, we are continuing to ramp back up our enforcement. So we did not have large teams out this weekend, but the teams that we did have out did see good compliance.
Thank you. Our next question comes from Angelica Sanchez at Fox 6 for County Executive Crowley. Can you explain the new COVID-19 efforts to reduce the spread in the county jail based on the press release last Friday?
Absolutely. So we have put in new testing protocols for our residents and our staff members, making sure that we are doing it, testing them more, I think every 2 weeks now. But we've also made sure to put in some protocols related to the transfers of those who are currently at the Milwaukee County jail and the House of Correction. So we're working directly with the Sheriff's Department in making sure those transfers are safe and keeping everybody at the House of Corrections healthy as well.
Our next question is from Ben Wagner at WISN. If there is a surge after Thanksgiving, when could we expect to see that data? Do you worry about a 1-2 punch with the holidays just a month away as well?
So typically after somebody is infected with COVID, so if people are infected on Thanksgiving, it would usually be at least a week until that data starts showing up, until tests start turning positive, sometimes up to 2 weeks. Hospitalizations usually are about 2 weeks after that, and deaths unfortunately also follow about 2 weeks after that. To the question of winter holidays, absolutely. The next few months are going to be the most challenging times we've seen so far in the pandemic by far. We know that an end is in sight. There's vaccines that are effective, but we have to get through this winter, and it's going to be challenging with cold weather, with indoor gatherings, with COVID fatigue, and certainly with holidays.
Next question again from WISN. A follow-up question for Dr. Weston. You mentioned the plan to expand testing after Thanksgiving. Does that mean additional community testing locations, expanded hours at existing locations, or something else? Can you provide more information?
Yeah, so we're continuing to look at what communities are in need of more testing. We have a model up on the public-facing dashboard called the SAFER model. It helps us to identify what communities are getting higher levels of testing and lower levels of testing. We've tried to distribute the community testing sites out, the health system testing sites out, but we're certainly working on other plans. We'll have more details on that in the near future.
That appears to be the final question in chat. Last call for questions from the media. All right. As a reminder, there will not be a briefing this Thursday on Thanksgiving. We will see everyone back here next week. Thanks, everyone.
Thanks, everyone.
Thank you.
Thank you. Happy Thanksgiving.